Thank you, Ms. Song, for that introduction, and thank you to all of you for attending this presentation, and to Ruth for a fantastic way to introduce the Australian team. I'd also very much like to thank KAORN for the invitation to attend today. I was an operating room nurse and worked in that field for about 8 years before I went into infection control. So I hold operating room nurses very deeply in my heart, and it's a privilege to be speaking with you and sharing my infection control knowledge. And of course, I would not be able to do that without the kind support of Ansell Korea. So to Mia and to Charles from Ansell, to Samson, the regional marketing manager, and to Teresa for communications, thank you again for this opportunity to share a little bit of my knowledge. I need to show you this disclaimer and point you to the bottom line, which says to you that on occasion I work for consulting to medical industry. However, all of the content in my presentation today is mine. It's not been influenced by any external bodies. So please know it's my opinions on research and literature and my experiences through meeting with networks, colleagues. What I would like to do now is talk to you about the areas that we'll be covering this afternoon. The first thing we'll talk about is maintaining skin integrity on your hands, and that's a very difficult objective for operating room nurses. In that discussion, I'll lead on and talk to you about contact dermatitis and then different types of allergic responses, type 1 and type 4, differentiate between those. Then we'll look at the differences between the relationship between powder-free gloves and synthetic gloves, and their relationship to both irritant dermatitis and to type 1 and 4 allergies. Then we'll finish with more practical issues around how gloves can be protective for operating room nurses, and the importance and the highly protective nature of double gloving especially. And I'll finish the presentation completely by looking at what your organisation's responsibility is, perhaps a little bit of what KAORN's responsibility may be in terms of standards, and what your responsibility is as an individual to stay safe in the operating room from an infection prevention point of view. So what I'll do now is look at how we maintain skin integrity. So the skin is our largest organ. It has a number of functions, particularly to maintain the integrity. To maintain its integrity is important from an infection prevention view. It stops microbes from growing on the skin. The pH is responsible for that. It stops us from losing water from our intracellular structures. It's also protective for us, and it's involved in our inflammatory responses. So the skin is very, very important, and I think we take it for granted, other than I think when we spend a lot of time in the sun or when we start to age, although your beautiful skin here doesn't show the same traumas that we suffer. Okay, so I'm just waiting for the interpreter, which is why I wait. What we need to do to maintain good skin condition. When you're working in the OR, you have many occasions when you have contact with harsh hand hygiene agents often, and they can cause you chronic irritant dermatitis. When that happens, you get cracks, fissures, burning, and it happens and becomes worse as you continue to use those products. As a result of that damage, staff then become reluctant to perform proper hand hygiene, or they may do it for a shorter period of time. And often we fail to actually stop and look at their technique. Instead, staff will come running to the infection control department and they'll say, "The gloves are causing a problem with my hands." In my experience, it's usually technique rather than gloves. But it's particularly concerning because when staff have cracked skin, their skin can become colonised, and so they can in fact be spreading infections around the hospital or to patients or to the environment. And that's not a very good situation at all. So the other problem that we have in regard to this is that, as you know, the operating room is a very fast-paced environment. Your hands do not get a rest. All of you becomes fatigued, but your hands become very tired. You know, they're very sore. With the routine use of gloves for sterile procedures and for cleaning, use of gloves for protection, it's very important that you wear gloves. But you need to make sure that you never put them on unless your hands are completely dry. One of the other important things is that you routinely moisturise your hands. And I recommend that you only use moisturisers that you know are compatible with the particular gloves and hand hygiene agent that you're using in your operating room. So whilst you may like a particular moisturiser that has a nice smell, please don't use it. Use the one that the hospital recommends for you because they'll know that it's compatible. So in the worst possible scenarios, in the worst cases, we end up with either problems of contact dermatitis or problems with allergy, and we'll look at them right now. None of us want to have a hand that looks like that. We want to have hands that look like this, or maybe a little smaller, less chubby hands. But the three problems that we can have are we can have the contact irritant dermatitis that I've spoken about. You can have a type 1 immediate sensitivity, or you can have the delayed sensitivity. And in the middle there, you'll see just how angry hands can become when they suffer any of those consequences. So let's understand the contact dermatitis. How it's different is it's a non-allergenic reaction. So it's just because you've had an irritant on your hand. You're not allergic, you don't have a sensitivity to it. And those irritants are things like hand hygiene that we've talked about. It's when technique is not good, when you don't dry properly. It can happen in weather, when the weather changes, when it's too hot or when it's too dry, when you've got a lot of air conditioning on, a lot of heating. Or you may have some other form of dermatitis on your hands, and that may just become worse. It also could be from mechanical abrasion. So if you use rough hand towel or in your social hand hygiene, so you really need to look after these precious things that are your hands. The other irritant that we've realised over the last few decades is powder that's on powdered gloves. So it's often the powder, not the glove composition that leads to that contact irritant dermatitis. That's very different to an allergy to natural rubber latex. Allergy to natural rubber latex, and the low proportion of workers who become allergic to natural rubber latex are usually exposed occupationally. And we do know that if we took 100 people that don't work in healthcare and we took 100 people who worked in healthcare, the 100 people working in healthcare would have 3 to 5 times higher rates of latex, natural rubber latex allergy than people who didn't work in healthcare. But your chances of having this type of allergy depend upon some of your predisposing conditions, whether you have other allergies, how long you've been wearing gloves, how frequently you wear them, plus whether or not you've had dermatitis in the past. So if you have any of those risk factors, the best thing that you can do is actually avoid unnecessary glove use. Now, you can't eliminate gloves because we need them for infection control purposes, but perhaps you can wear them less, or there are some times when you do not need to wear them that you just might be being lazy and not taking them off, or you might be being overprotective. So good, rational, sensible use of gloves is really important. The other thing is always make sure that you use non-powdered gloves, because remember, the powder is the irritant that can cause that dermatitis, and it can cause this natural rubber latex or contribute to it. And then, of course, for healthcare workers who are truly sensitive to latex, using non-latex gloves is a good option. And that's also important when you're caring for a patient who has a known latex allergy, because you don't want to be touching them. So a different type of reaction is a type 1. And this is a very dramatic and very rare type of response. We don't see this very often, but when we do, it's very, very dramatic and potentially quite dangerous. And it happens when someone who's sensitive has direct contact with a specific allergen. In this case, natural rubber latex proteins or other chemicals. And what happens is it causes a serious immune response, and the affected person begins to itch. They can have burning, they can have airway obstruction, and then very rarely, but sometimes, they may go on and have a full anaphylactic reaction. So this is different to contact dermatitis, and one of the major things is that this will happen quickly, within 5 to 30 minutes. So again, we can avoid it with some fairly simple decisions, and I think it's your responsibility to be aware of this, both as organisational leaders who are purchasing gloves and supplying gloves, but it's also important for you as individuals to be thinking about yourself and also your colleagues who may be sensitive to these issues. And the ways to avoid this: use latex-free gloves, only use powder-free gloves, and always wash your hands after glove usage. The other thing is that for those young nurses new to the operating room or new to clinical practice, it's the first 3 years of your exposure that are crucial for you developing the allergy. And I think that, as I sit here and I hear about fatigue and I hear about these occupational problems that we have, and in fact the whole theme of this conference, it says to me that organisations like your global operating room nurses, KAORN, KAORN in Australia, we have a huge responsibility to attract people to the profession, and particularly to your specialty. So we need to make this as safe as we possibly can, so that we make operating room nursing attractive, as we all know it is, and we let other people come in and have the wonderful life in theatres that we've had. So type 4 sensitivity is chemical, it can be delayed, and it's different to type 1. It happens when there are residual chemicals in the gloves, or they may be fragrances, perfumes, or preservatives. And the relationship that's been described in the research is that it can be accelerators within the gloves. And accelerators are used in the glove manufacturing process to get vulcanization of the rubber. And so you will get a subsequent allergenic contact dermatitis in operating room staff and anaesthetists. So it's important to know good practice is important, so is good choice in gloves. Hang on, I'm going backwards here. Protecting your hands is really, really important. So I talked a little bit about moisturising. The other thing to do is to make sure that you always are wearing gloves when there's a potential contact for you with a contaminated environment or with chemicals. that are used for reprocessing your reusable devices and equipment. Also, make sure that the gloves that you choose to purchase are relevant for you as an individual and that you offer your staff a range of gloves, because you will have a range of needs across your clinical staff. So on the shelves, you can't just have one type of glove. You need to have several different types of gloves because some staff will only be able to wear these specialty gloves. If your hands start to show cracks or burning or they have fissures, go and get some appropriate treatment. Go and see the infection control nurses, speak to the operating room managers if that's not you, speak to occupational health and safety, and get good assessment. Get your hands treated because you need to exclude some of the more serious concerns. And as I said at the beginning of this talk, mostly it will be an issue around contact dermatitis. And the other very critical and simple thing that you can do to help yourselves is never, ever, ever put gloves on unless your hands are dry. We're very fortunate these days that for the last few years in this part of the world we've had very protective gloves that manufacturers have designed, and they have special unique inner coatings and special formulations that reduce the potential for irritation. So they're fabulous. They reduce reaction, they're very comfortable, they provide support, they're soft, and they have a good natural fitting. And some of them, in fact, may include moisturising agents or agents to help us retain water in our hands or other barriers, which help our hands to feel good and for us then to work well with them. So moisturisation and some of these luxury gloves are a good way, again, to protect our hands. So I've spent the first period of time talking to you about all the bad things that can happen. Now I want to tell you how these gloves protect you not only from skin irritation, but from some of the other things like bloodborne viral transmission. Let's have a look at your environment from an outsider's viewpoint. When I look at it as an infection control nurse, I see a few things happening. I see that when you wear gloves, you have a reduced sense of touch. So it's not like when we touch something sharp when we have no gloves on. You've got this barrier. You're also working in a very unnatural, often controlled situation. You might be in an awkward position and you may not be able to move, exactly like I am now. You know, I'm not in a very comfortable position because I can't step down, I'm up. And you're like that when you're scrubbed. You've got a very limited movement. You also work in an environment where there's lots of distraction going on. So machines are beeping, people are calling, buzzers are buzzing, a surgeon's asking for a scalpel or a particular instrument. So you're constantly under stress, and I can see how stressed you all look now. Now you all look very relaxed today because you're not in the operating room. And the other problem is that you're working often where you can't see well, so in dark areas. All of those things set up a perfect storm for sharps injury. It's something I've been particularly interested in and researched extensively over the last 25 years particularly. Because every instrument that you use that has a sharp part of the instrument, or it has a jagged edge, or a pointy end, or a sharp part of it, is a potential deadly weapon for you in the operating room. We know, and Ruth's talked about it, that up to 20% almost of surgeries involve a sharps injury. What's more scary is that more than half of those injuries will never be reported. So what we know is just the tip of the iceberg. And we have to think and we have to extrapolate and we have to estimate the true extent of this problem. The most dangerous piece of equipment is the suture needle, and it's as you're coming through and you suture in. So we've seen some changes with protective devices, with glues rather than needles. So suture needles and scalpels are also deadly, and hypodermic needles. Those three things account for 3/4 of all injuries. We also know that OR nurses can get exposures to the mucosa. So if you don't wear your personal protective equipment properly, you will get splashed in the eye. You may inhale something into your mouth, into your nose. You may be hit in the mouth. And that's a very good argument for why even anaesthetists should routinely wear surgical masks. Everybody in the operating room should routinely wear a surgical mask. When we look at the body parts that are typically injured, you will see that almost 100% of injuries, sharps injuries to nurses in the operating room involve the hands. It's usually the left hand, and that's because of suturing, as I showed you before. So more than half of these injuries. So it's a very high-risk activity. Is there anybody here who's never had a sharps injury? Raise your hand. Okay, so you all appreciate how important this is. I too had several injuries when I worked in the operating room. And just to show you that this is not just a problem in other countries, this is a problem in Korea. And we have Dr. Oh's research with Yoon Chang and Hoi and Park published last year, and they showed us that there is a high proportion of needle stick injuries happening, sharps injuries happening here in Korea, and that 1/4 of them were very expensive to manage afterwards. And the national cost in Korea here is about $885,000 per year. Now, that's a lot of money that we could be using to buy equipment to stop pressure injuries in Korean hospitals, or we could be putting it into some other form of operating room nurse to make your job easier as nurses in the OR. So the direct costs are very high, and it's a burden that you don't want on the Korean national healthcare system. So we see similar sorts of reports from other countries. We see that gloves seriously reduce the risk of needle stick injury and transmission. This was a study in an orthopaedic surgery that happened in a hospital in the United States. And we have to say that one of the important points in the lower level down here is that glove use among healthcare workers is very inconsistent. I find that very scary. And around the world, we need to standardise this practice, especially when we see things like Ebola and when we see other infections, even our routine day-to-day infections. We need to always be consistent in our practice so everybody knows what to do. The other thing is that glove use is a key element of any sharps reduction program. So not only can it protect your skin from direct exposure, use of gloves can protect you from sharps injury and from disease transmission there. So when I've provided all of that information, what's the key messages? What are the key messages for you as members of the operating team? The first message is that being safe in the operating room is not easy. In fact, it's very difficult, and the solutions are quite complex. But it's also very necessary, and it is achievable, and I'll show you how other countries have achieved that. The requirement for safety is across every level of the organisation, so from administration to managers to senior clinicians, normal clinicians down to junior clinicians and student staff, to non-professional healthcare workers, ancillary staff. Everybody has a responsibility to improve safety. And you, as operating room nurses, have a big responsibility to do that. So we can do that through education, through changing behaviours, and education will lead to behavioural changes. We can also change the products that are available. And we make sure that when new products come in, that people know how to practice properly with them, whether it be new hand hygiene formula, whether it be new safety engineered sharps devices, or whether it be new gloves, latex-free gloves and powder-free gloves, specially coated gloves. So there's lots of things that we can do to change practices, And there's lots of technologies that we can introduce to make our operating room nurses safer and to give us better patient outcomes. I'm going to look specifically now at powder-free and synthetic gloves. So powder-free gloves are those that we've been using since about the mid-90s, and we use them because they have a much less risk for adverse events amongst staff and patients. And then normal risks like getting granuloma forming from the powder, getting dermatitis or respiratory distress, or in fact having a hypersensitive reaction. So the glove powder, as I said to you, is part of the production process, and it's used to help us when we're putting our gloves on and off. But what we know is that in the new formulations of powder-free latex gloves, there's a much lower residual protein content, and it eliminates that risk for aerosolization and dispersal of the powder into the operating room environment or into the surgical field. So we're very lucky in Australia as a first world country to have a majority of gloves that are used in my country, Ruth's country, are powder-free, and they therefore have, our Australian operating room nurses have a much lower risk of becoming sensitised than in countries where powder-free is not the routine use. So similarly, we have the options of latex-free alternatives. So there's a large range of powder-free, latex-free, synthetic and specially treated gloves that are available. So the ways that manufacturers have offered us new gloves around this, it's been through new composition and new production processes. And some of the examples are natural rubber latex protein-free gloves, gloves that have none of these chemical accelerants, those thiorams and mercaptobenzyl thiazones. They're free of those and also free of latex and free of chemical accelerants. So it's fabulous that we've got these new systems of production. There's another system that is important when you're in glove production, and I'd suggest that you check that your manufacturers of the gloves that you use follow this protein and endogenous allergen reduction leaching. It's a final step in production and shortened to pearl reduction, and that will reduce the protein residual even further. So when we've introduced these safer gloves into our hospitals, what we see is that we have fewer latex symptoms, we have reduced numbers of sensitisation, we have reduction in workmen's compensation, and we saved lots and lots of money with that. We have much fewer cases. We've reduced the decrease from 5.9% down to 0. In 7 years we've seen that. And we've seen much lower incidence of irritant and contact dermatitis. So these gloves work. Now let's look at something else which is equally important, but this is a practice measure. And that's the issue of double gloves. I said to you that people don't routinely wear gloves in a standardised way. So when we make it even more complicated by asking people to wear 2 pairs of gloves, it's not surprising that some people object. And the major objections to date have been around the fact that people say they cannot feel as well when they have 2 pairs of gloves on. But in fact, we know from comprehensive studies that have been done that there's no difference in the way that people feel or the way that their hands perform when they wear either 1 pair of gloves or 2 pairs of gloves. So I don't accept that argument anymore as a reason not to have double gloving. The gloves have become so comfortable and can be so worn for such extended periods of time that without getting your hand crushed or getting pain in your hand or reduction of movement, that we don't have that. And in fact, we've had a very big Joanna Briggs systematic review done, and it shows us the difference in perforations. So the difference in sharps injuries when you wear 1, 2 or 3 pairs of gloves. So when people wore 1 pair of gloves, almost 10% of them had a perforation. When people wore 2 pairs of gloves, again about 10% on the outer glove, but only 2% on the inner glove. So that means that for 8% of those injuries, that inner pair of gloves was protective. And then when people went up to 3 pairs of gloves, it went down to 0. And I'm not advocating 3 pairs of gloves just yet, but maybe if I come back again in 10 years or so, it might be 3 pairs of gloves. But certainly there's a lot of sense in wearing of double gloves routinely. So double gloves reduce the risk of compromising that inner glove, and it can reduce the potential for you to have contact with blood by 10 to the power of 2 rather. Now, not only are needle stick injuries a good reason or safety from contact in a needle stick injury, the other important thing to think about is that bacteria do pass through perforated gloves. So in terms of bacteria from your hands going into the surgical field, or bacteria from the surgical field coming onto your hands, which may be cracked, have minute cracks on them from just the wear and tear on hands, you want to do everything you can to stop bacteria passing through those gloves. And the most important way to do that is to wear 2 pairs, because it reduces the potential. And we know this from a comprehensive study done in Australia. So there were very interesting results around glove use, and I know I need to wrap up quickly, but what they found was that more than 10%, 15% of healthcare workers had a perforation in their outer glove. So just through doing normal work in the operating rooms, that outer glove will become perforated in 15% of the time. Almost all of those perforations were in the non-dominant hand and involved the index finger, again probably through suturing. They also had bacterial passage in almost 5% of those perforated gloves, which is pretty high in my mind, and again a bad thing for occupational health safety reasons and also for potential for surgical site infection. What was concluded by these authors was that many of those tears or perforations in the glove were not immediately recognised by staff. So they were too small to see, and that those perforations were large enough, though, to allow passage of bacteria, which are very small, and probably passage of viruses as well if we tested for them. So they suggest that every 90 minutes, if you're wearing double gloves, you should change your outer glove. And even if you're wearing single gloves, which I hope you don't, you should probably change your single gloves every 90 minutes, because that's about the life of a glove, even the best gloves. So there's been further work done on this in Hong Kong from a group, and they concluded that double gloving is an effective way to protect operating room nurses against blood-borne pathogen exposure. It should be introduced as routine practice. And I know that that's been one of the recommendations that KAORN has been looking at, that AORN from the US actually makes. Again, there's been further studies on it, this time undertaken in the UK, and again the same type of conclusion. Double gloving, in this case they say, doesn't have any impact on manual dexterity or sensitivity. So don't accept dexterity or tactility as a reason not to use double gloves. It doesn't work. When you're looking at surgical gloves, you need to have all of these things. You need to make sure they're easy to put on, they're comfortable, that they fit, that they're resistant, they're not slippery. They're the things you look for in a surgical glove, and you will get them in double gloves as well. When it comes to double gloving, one of the reasons people resist is that they don't know how to do it properly. And what I'd say to you is that you need to find your own personal technique. There will be a different combination that will work with you in terms of smaller one on the inside or the outside. Whether you put them on, which ways you do them. There will be a way that is most comfortable for you, and different combinations or compositions of gloves that will be comfortable for you. Once you find that, make sure that you standardise your own practice and that you always have these double gloves on for those risky procedures. I think this is one of the most simple but one of the most effective solutions we have, which is the use of a darker inner glove, so that when your outer glove, the pale glove, perforates, you can look and you can potentially see that darker inner glove, and you know that you immediately have to change your glove and perhaps both gloves at that point. Because, as I said to you before, very few nurses and surgeons notice that their gloves have been perforated. So there's lots of different combinations that you can wear. And when it's been studied that when people wear these more noticeable inner glove, when they've got 2 pairs of gloves on, almost 90% of the time they will notice the perforation compared to when they wear 2 pairs of gloves that are the same colour. So it's a really good, simple idea, and it looks pretty as well, I think. So when you wear that darker colour, you will get more outer glove perforation noted. And I think that notice of that leads to better, more appropriate glove change and more frequent glove change, which is good. So the things that I'll leave you with, the points for practice, is 1, routinely check your gloves for perforations, even if they're not obvious. Second point, double gloves routinely, and especially for major cases. Those cases where you can anticipate contamination or when you can anticipate that you will be in there for a very long period of time. If you are wearing double gloves, and I hope you will, if the outer glove is perforated, it's smart to change both pairs of gloves because you can't guarantee that that inner glove's not perforated. We know that bacteria and viruses can go through both, and you don't want to be in contact with bacteria and viruses through gloves or through glove. I'd say to you, experiment until you find the most comfortable, most usable, most appropriate combination of double gloves for you. And this is a responsibility that goes completely across the organisation. They have a role in safety, as always, and they should provide feedback to staff. They should provide funding to make this happen, because in fact, if they don't, I believe that they're negligent. They need to put systems in place that help make it easy for you to introduce these types of changes, just as they should for every other patient safety and healthcare worker safety change that happens. The organisation can do all that. They can create a perfect environment for you, but in the end, you have a personal responsibility as well. And that personal responsibility is to adopt these safe behaviours, to use safety engineered devices where they exist, to avoid fatigue, to avoid strain, to avoid Sharp's injury, to always follow the recommendations that are included in standards and in government policy, your local policies. Make sure that you look after your own blood-borne viral status, that you use equipment and devices safely, particularly personal protective equipment like masks, glasses, goggles, and gloves especially. And that includes wearing double gloves, in my honest opinion. So I'll finish up, and I'm sorry for going over, but I'll just say to you that remember, where you work every day is a very risky setting. You can have a lot of occupational exposures, and there's a lot of potential for patient harm. If you can maintain the integrity of the skin on your hands, as I showed you, and keep them safe, then your hands will keep you in good stead for a very long time. That's very, very important that you do that, and wearing the best, most appropriate glove or gloves is one way that you can reduce the potential for irritation. All of the things that I've talked about today are fairly simple, but you need to adopt them and be consistent with their use, because that's the only way that you will ensure operating room nurse safety across Korea. And I wish you well in those endeavours. And again, I'd like to say to you, I'm very grateful for this opportunity and for your attention today. I'm happy at Madam Chairman's wishes to take any questions if we have time. Thank you.